we have Michael, we have Isa, we have Claire, and we have Zenaida with us right now. More people will be joining us soon. Just to give everybody's, of course, MS Warrior here, and Isa has lately had MS relapse,
Yeah.
and especially looks fatigue, and she was also diagnosed with coronavirus. So lots of things going on in her life too. But
Yeah.
nevertheless, she's still here to meet you here.
Yeah.
Hey, nice to meet you guys.
Nice to meet you.
So, do we want to start with some of the questions with the doctor right now? If you guys have any questions noted down.
Yeah,
I have a question.
I have a question, just whenever.
Cool.
Okay.
Go, Claire.
Okay, thank you. I've got two questions. If I shoot them off now, and then if they get answered in the conversation, then great. I've just started doing physical therapy over the last 2-3 months with another doctor, and it was brought to my attention that a lot of people with MS will benefit from physical therapy. But there's a distinction because a lot of the MSers really go for it on exercise, myself included. There's a difference between fitness and functional exercises. So I'd like to pose a question to Dr. Zolo about the differences about between fitness and functional exercising. I know the answer, but for others' awareness, I would like to pose that question, the differences between the two, so he can explain from his point of view how bespoke physical therapy can enhance fitness within the MS journey. But the functionality exercises is something I would like to hear his views on.
Yeah, so, we want to make sure when I evaluate a patient, because I get patients who come in just diagnosed and really it's just very mild symptoms. Like they can just start telling me that they just felt weaker in their one leg. They felt like they were dragging and they just got this diagnosed, even though they've had these symptoms for a long time and no one can figure it out. And then I get other patients that are using canes, walkers, wheelchairs. So my goal is to really find out at what point did they really start to kind of decline and what kind of things do they need to do to get back to doing, because everyone has different goals. Some people just want to be independent. Some people want to be able to do the MS walk. Some people want to run a half marathon. I would say more like functional. We want to make sure everyone can go up and down their stairs, get out of a chair, get in and out of a car. Starting with the basics is really the more functional aspect, because a lot of my patients might do simple things and might get really, really fatigued because they're not training the right muscles. So I would say my point of view is a functional exercise is to make sure that they can do everything they need to do in a day-to-day life. And then physical fitness is more so, what are they trying to accomplish? Because someone that physically fit, they just have goals of being able to walk their dog and, walk for a half hour without having to sit down. Whereas someone wants to go to the gym and do yoga and do Pilates. So that would be my explanation for differentiating the two.
Okay, thank you.
Does that explain it?
Yeah, absolutely. I mean, I knew from my physical therapist who's doing some telehealth with me. I'm based in the UK, she's based in the States, so she can't actually treat me, but she can give me some bespoke exercises. And my anxiety was around walking distance. And my second question to you, which tapped onto that question initially, was about how we could improve as MSers our fatigue. And my particular anxiety is around walking. So at the very worst, I could walk for 20 minutes. But now I'm up to about just under an hour. And I want to walk further. Maybe I'm greedy,
Right.
I don't know. But I'm wondering whether you can offer any tips for fatigue.
Yeah, so the way that I treat my patients in the office, when I was going to school, PT school, the way they educated us is with MS, if someone gets, once someone starts to get tired, that you don't want to kind of exercise them anymore. You want to really just do more low-level exercise. That was the thought back in the day. So the way that I look at it is every patient is different. I can give one patient, 6 exercises and they could be wiped out for a really long time. Or I could train them for an hour and a half straight and they might feel a little tired, but they can bounce back the next day and feel okay. That's my goal. I want to be able to push the patients while they're in the office. But really for endurance, you have to really find out what is the muscle that's weak. If it's the ankle that's dragging and it forces your hip flexor to really compensate, or if it's your hip flexor that's dragging, you have to use a lot more of your hamstring to like go up and down stairs. Finding out what specific musculature is affected more so than the others, and then trying to focus on that muscle group. And doing more repetitions. So for me personally, when my patients are a little fatigued, I like to kind of exercise them a little bit more, because if you don't exercise when the person is fatigued, you're never going to kind of build that endurance. But also you want to keep it consistent, getting into a routine, like just exercising once or twice a week. Yeah, it's better than doing it nothing, but you have to try to find something that you can do every day, work the hips and the ankles the most, because that's what's responsible for walking, is your glutes, your hips on the side, as well as your ankles.
Yeah, I completely agree. I think if you do a little bit and often, I find that now I'm into a routine of exercise, it gets easier. So my walking distance has increased. So
Yeah.
slowly, I will add on some extra minutes. So, walking for 45 minutes is great. If I could do a little bit more, it might be fantastic, but I don't want to push myself too much. I think that's kind of...
Right. You could also try walking, maybe starting with like 1 pound ankle weights. So if you walk with ankle weights, just like for your exercise, that'll get your legs a little bit stronger. So, but make sure you're safe. If your walking is a little unsteady, like anytime you try something new, I would always do it with somebody, because I don't want to tell you to put on, these ankle weights and then you go outside and trip over something. So really,
I have somebody to walk with me every day.
okay.
So I'm super lucky. And I was just about to try out therapy bands. Have you heard of those?
Yeah, just a regular resistance bands.
I've got a light one, a yellow one, which the group recommended to me on the last call last week. So I've now just got one of these bands. So I'm going to be practicing a little routine with those to see whether that add into my daily routine, even if it's just half an hour, just to try.
Yeah, so I posted a video on one of my posts that I think MS Awareness reposted.
Yeah.
So really just kind of kicking your leg out to the side, kicking straight back. Yeah. Those are really the two most important muscles for balance on your pelvis. So you're really working the hip on the outside and your hip extensor. Yeah. And then going up on your toes and going up on your heels is going to focus on working on the ankle strength. Yeah. And then I always like to throw in core strengthening as well, but not like crunches, but maybe trying like some planks, seated on a stability ball and doing some workouts that way. So, just a form of consistent exercise. If walking is challenging, biking, because biking could do seated and that's going to keep the legs moving. So that's how I kind of try to treat the patients, is really trying to find what exercises they're going to stay consistent with and be motivated to continue. Because the main thing is getting into a routine. If you can get into a routine and make it a habit, then, you're going to keep up with it.
That's great advice. Thank you so much.
You're welcome.
Lisa, would you like to ask your question?
Yeah, I actually messaged you, but you probably didn't read it yet.
Today?
Yeah, this morning, really early. I saw the video that you're talking about. I've done those. I do a lot of yoga. As a lot of people know here, I'm pretty good at it and I'm pretty strong. But the problem I'm having now, which I've had over the course of 8 years, is I have a relapse or I have an exacerbation, and I'm here, I'm strong, I'm doing well, I'm at a level where I really feel comfortable. Like you said, fatigue is not an issue anymore because I have a routine, I have discipline, I meditate, I eat well, all that stuff. But now this happened and I have been flat on my back trying to get on my feet, but it's just impossible, for a month. So, how quickly muscle atrophy sets in, my balance is really poor. I just don't trust my strength and or anything else, to be honest with you. So I guess my question is, I understand what to do when I'm just like in everyday mode of MS, of like when I hit a little bit of fatigue, I'm like, all right, take a step back, push yourself a little, but not too much. Like what you were just talking about, that aspect I've really kind of learned to hone in on. But this, I guess my question is, where do I start? Because like when I first got sick, you know, I started trying to like just getting in the pool, but that didn't work right away, you know, and then I tried just stretching. And to be honest with you, doctor, I'm scared. I'm scared because this was bad. This one was really bad and it took me down really hard. So I want to get better. And I know exercise is like for us is key, and our diet as well. So I guess where do I start? Because even though I've been here before, we as MSers, I think, have these massive built-in forgetters on, you know, and I think everything, as our body deteriorates and or recovers, everything changes, I think. So I guess that's kind of what I'd like to know. Somebody that was like myself doing yoga, you know, as a lot of you know, I do it like 3, 4, sometimes 5 times a day, and I was very advanced, self-taught, everything. So where do I start after, you know, having possibly been exposed to and have the coronavirus, you know, an exacerbation as a result, a systemic infection, which started on my eye and it's now my face, which is improved, of course. You know, I'm on doxycycline, you know, the Solomedrol, last Solomedrol was Tuesday, I believe. Anyway, so that's, I guess, if I asked it right. I don't know if you get
Yeah,
what I
so
was asking.
have you reached out to your neuro out there? Are they aware of the situation?
Well, yeah, they've been in contact mostly with me trying to make sure I'm getting better. You know, they're not at this point even asking about, like, they're just like symptoms, like how are your symptoms? They want to know every day if the symptoms have been improving. Other than that, and how I'm tolerating the medications and dealing with the side effects of the Solomedrol, which make me crazy. So that's starting to taper off just a little bit. But other than that, I haven't been directed in any way. Usually after an exacerbation, I'm on my own.
Okay, so they don't put you on like a steroid treatment after that?
Well, I did 3
Okay,
days.
so
I did
they
already.
did take, medically, they took care of that for you. So
Oh yeah,
on an exercise
in the hospital.
component,
In the
yeah, so
hospital.
you said you tried the pool. What happened that it didn't work? What was challenging in the water?
I was afraid. I was afraid I was not going to be able to swim. And I'm a great swimmer. Um, and I just don't know where to start, you know, right now.
Yeah.
I don't know what to do first. Like I attempted each day, the past couple of days, put on yoga clothes, but I never made it on my mat. I just have a sense of my body when it's ready to start and when it's not. And I don't know if it's just fear that's keeping me from.
Yeah, there's a low confidence.
Yeah, very
so
low. That's a great comment. Exactly. That's it.
what do you notice is the most challenging? Like, do you notice like your foot is dragging? Do you feel like the leg is the hip flexor? What do you feel like is the part of your body that's kind of do you feel not confident about? Yeah, weak.
Weakest.
Exactly.
I would definitely say the legs.
The legs.
Yeah, because those have always been my problem. And I was trying to focus on developing tight, you know, good hip flex, you know, flexible strength, etc., through yoga and all that. But definitely the legs, I would have to say, doctor, overall, just quad, glute, hip.
Okay.
Yeah, it's just a lot of muscle atrophy has set in, which sucks.
So I would try, you know, some of those workouts that were shown in that, like I would try to, if you're just starting to feel a little bit better, body wise at this point, because if you have like the corona, you said you might have had corona, I would try to keep everything a little bit lower level to start. Maybe instead of doing 3 sets or 4 sets of an exercise, maybe try like 6 to 8 workouts, but just 1 round of 10, really simple, just to kind of get those muscles going. So, you know, real simple. Like if standing up bothers you, then maybe just doing some things laying on your back. Are you familiar with bridging? Like, you know, when you're laying. So maybe doing like 10 bridging, then having your legs straight and kind of doing like a leg raise on your back, laying inside, doing a hip abduction on your side, laying in your stomach, doing like a prone hip extension, and then maybe just getting in a chair and just having your arms crossed and doing like sitting to standing, because that's a really tough exercise on its own if you're not using your arms. And then just trying to go up on your toes and heels in a seated position. So let me see if I can get this around. So if I'm like here, just trying to go up on your toes, go up on your heels, but just trying to do a round of workouts that it's not strenuous. Can you guys see me? Sorry, I'm not sure.
Yeah.
So just trying to do like some stuff laying in your back, laying in your side, sit to stands, just one round of all of that. Next, say you feel tired but okay overall, repeat it. If that starts getting a little easier, progress it 2 rounds, 3 rounds.
Okay.
You know, just training your balance. You can really just kind of stand and put one heel, one toe in front of each other. So if I'm like here, you can see I have a little gate behind me. So always try to do something where you have support behind you, because you don't want to, if your balance is low confidence right now, you don't want to just go and, you know, try to stand on one leg in the middle of the floor, because if you lose your balance, there's no one there to catch you. So I would try to find an area where you have like something surrounding you. And if that's easy, then progress it to kind of standing, you know, close your eyes, stand on a pillow. But upon an exacerbation, I would try to reinitiate gentle, low-level workouts, see how your body tolerates, because you might tolerate it well, someone else might not tolerate it so well. And then from there, progress it day by day. Don't let that get you down, because like you said, like healthy eating, continue those habits, because if your body's in a state of inflammation, the last thing you want to do is, you know, drink a ton, eat unhealthy, and then kind of make that exacerbation even worse than what it is.
Yeah. Definitely.
So that's actually, you know, I can, because they reached out to me to make a video. Maybe I can make a video for you guys, just sharing some workouts, gentle modified workouts post exacerbation. I haven't really seen any videos of that, but it's really more like general, but I can do that. And then we can maybe do like, maybe we could host a series like week by week, MS workouts based upon these comments. So based off of this, I'll make one when I go back to work on Monday, and I can make one like gentle workouts after exacerbation of symptoms. And, you know, if anyone else has any questions, we could just kind of write them down, what workouts you guys are looking for, and we can post them week by week.
That sounds great, because I've never seen anything like that on Instagram. I've seen people that have MS that work out like myself, and tons of us warriors out there that were badasses, but post relapse or even a pseudo exacerbation at home, that's really just boom. I've never seen a real.
For me, it's tough because I work in the outpatient clinic. So if my patients have an exacerbation, I usually don't really see them for a while, because it's tough for them to get to my clinic. So I haven't really had too much hands-on experience. I've had some people who have, like, you know, have had MS and they say they have an exacerbation, and then they show up to my clinic like a month later for the first time. But I haven't really had too many patients where I've treated them. They're coming in, no cane, no walker, everything's doing well, and then they have like a severe exacerbation, and then they come to my clinic the next day and like a walker. I haven't really had that, because usually when they do get a pretty bad exacerbation, the doctor puts them on like a 2-week, you know, medication protocol, and then I see them once they start feeling a little bit better. But, you know, I'd like to try to put some content out there, and then you guys can give me feedback on how it was.
Yeah,
Perfect.
because I say, you know, when once a person has a relapse of MS, how the confidence levels actually goes down, so any person for that matter. Once you are running and the other moment you are just bedridden, it's a very scary situation also to come back to your normal routine. So this exercises would of course be very helpful.
I'll try to maybe post, you know, something that exacerbation, you know, week 1, and then maybe like that's all laying down in a bed that people don't have to get out, because, you know, it's not just MS, any condition, you start to lose musculature after 3 days of just laying around. That's how long it takes to develop muscle atrophy, but to redevelop strength takes 6 weeks. So we have to really work on getting those muscles activated. Even if we're not taking a mile walk around the block,
Yeah,
even just doing some things around the bed can be, you know, detrimental to really reduce the significant atrophy.
absolutely. We can see Violet here. She's getting an infusion right now at the clinic, and she's still here with us. Okay, any other questions, anyone? Angela, do you have any question to ask the doctor?
No, actually, I just kind of jumped in. I just finished a Zoom workout and I just jump in. I'm like, oh my God, 11 o'clock showed up. So just
Thank you.
what's going on, and, you know, wish everyone a beautiful Saturday and just gain as much knowledge from everyone here.
Is anyone here from like like New Jersey, New York area, or people not
I'm
really?
in New York.
Okay, what part of New York?
Long Island?
Oh, okay. My practice is in New Jersey, but I grew up in Brooklyn, New York.
Oh, okay. Yeah, so I'm out on Long Island, and so we're still on lockdown. They actually extended us to June 15th.
Yeah.
Oh,
Yeah. So our office, we've still been working this entire time. We've just been in masks and giving the patients masks, and really, you know, when this all happened, because I work primarily in outpatient neuro, a lot of my patients with MS and stroke and Parkinson's weren't comfortable coming in. But as time went on within the past month, I've had some patients kind of start returning to therapy because they are getting worse, you know, without the treatment. So I've been at work this entire time since, but I'm hoping everything calms down as, you know, as quickly as possible.
okay.
One, you know, the way that I treat MS is very specific. So what most people, if you go to a doctor, um, and you experience some type of symptom, everyone's going to just look directly like say, well, that's because you have MS, where I'm looking at really the whole body approach. I have a lot of patients that come in with leg numbness or arm numbness, and the doctor tells them that's because you have MS. That's normal. But it's really, for me, that's not normal. I find that a lot of the numbness is coming from the cervical or the lumbar spine, because a lot of times, you know, if the muscles, the extensor muscles are getting weak, the neck starts to hang forward, or if individuals lose balance, they usually try to kind of arch their back backwards, and that's what causes a lot of tension through the nerves. So I really try to look at the whole picture. So if you guys have any specific questions, I'd love to kind of answer them on these meetings.
Thank you, doctor. Doctor, one question I will be having, that is, it happens quite often now. When I get up in the morning, I see that my entire right side, so my first MS attack was on my right side. Uh, all gets swollen. My face, my hand, everything becomes heavy and swollen. The only remedy to this is I rest. I sleep as much as possible. I'll rest for 2 3 days and then it is a little better. I've never taken any kind of medications for it, but quite unpleasant. And now during lockdown, maybe because we are indoors, we're not moving out, it's just getting quite often that my entire face is just swollen, or it's like when half my face is just too stretched up. What do you think this is because of? I mean, I thought maybe
Have you ever had experienced this before, or this is all brand new within the past month?
No, I had experience like this before as well, but that was like quite bad. This is not as severe as that, but I have had such experiences, yes. I thought I was relating it to migraine problem, which I developed lately because of MS, of course.
Which
But
problem? I'm sorry, I didn't get that.
migraine.
Oh, migraine. Okay, yeah, just cutting in and out a little bit. So when you get that, do you get any visual disturbances or feel nauseous or anything?
I just don't want to see the screen. I do not want to see the television or mobile, nothing. It's, nausea, yes, I feel nausea. Yeah.
Okay. So, I mean, yeah, it definitely can be some migraine symptoms. A lot of, you know, the migraines, what I assess is one is like vision, because MS definitely affects the vision with the optic nerve. And if someone's on the computer a lot or using a lot of screen time, if your vision is not able to process all the information correctly, then that's going to put more strain and can cause a headache or migraine.
Right.
So the second thing is really looking at the neck musculature, like right underneath here.
Yeah.
So one thing is you always want to, if you're typing or you're on the phone, you don't want to be in a kind of flexed position. You always want to try to keep yourself upright.
Yeah.
And one stretch that I like to do is have the patients put the hand behind the head and just bring their chin down,
Okay.
nice and gentle, and you really get the stretch right underneath the skull, which are the suboccipital muscles.
Okay.
I would use like two hands. I just have one hand holding the phone, but
Okay.
trying to hold for 20 seconds. But if it is a migraine issue, then really trying to find what the trigger is. Cardiovascular exercise is very beneficial for migraines as well as MS. So, you know, I really encourage not to go out where there's 1,000 people outside, but even in this time, try to, you know, if you're reading, just try to spend some time outside, not being completely indoors, because there's also correlation with vitamin D deficiency with MS exacerbation. So, you know, just trying to spend as much time outdoors as possible. Keeping the posture good, because right now everyone's doing a lot of work at home, and with their at home, you know, hobbies, they're putting a lot of tension on their neck and the low back and everything like that.
Okay. So it might be related to migraine. Okay.
I've
Definitely.
got a question.
Yes.
Hello?
Hi.
Yes.
I've been told I have to be housebound for another 12 weeks, which is really annoying.
I'm sorry.
Sorry.
You said housebound for 12 weeks, and then what was the part after that?
I'm really annoying. Because
You're annoyed. Yes.
I'm very.
Okay. Please record.
Sorry,
But-
it keeps breaking in and out. Maybe either if you can repeat one more time, or maybe type it, so I can read what is typed.
I don't see how you type it. Anyway, it's just annoying having to be housebound.
Right. Yeah. Definitely. I know. You know, every region has different sets of kind of rules and boundaries, but you know, being no one's really housebound. Everyone can, you know, at least outside of your house or apartment, or, you know, just pulling up a chair, just try to get outside.
Garden.
And yeah, garden, 100%. You know, just because we're not allowed
I'm in
to
the
go.
garden right. I'm in the garden right now.
Okay, good.
Hang on, I'll show you what. Oh, hang on. Because this little. You see?
Your voice, your video is getting paused.
Does anyone else have any questions that I can assist with?
I have a question about diet. I'm
Hang
sorry.
on.
Yes.
I know I'm monopolizing the doctor, but
Putting
What-
I'm outside.
what are your thoughts on diet? Like, there's so many things on, like, the Dr. Wall's diet. There's, you know, the
Right.
keto diet, the paleo diet, the gluten-free diet. Like, I mean, I can go on and on. Vegan, vegetarian, blah blah blah. I am an intuitive eater. I try to stay away from junk. But I'm guilty of it. Like, is there something that you tell your patients or recommend, or you've heard that, like, you know what, this is really the lane you should stay in? Or just every person's different, like, just like every human's different, you know what I mean? They react to food differently. So I was just curious on your thoughts, like high levels of sugar intake, you know, things like that. Like,
Yeah.
is there something, what do you recommend?
So within our practice, we had a functional medicine doctor, and what he would do is perform a food sensitivity test, because, like you said, everyone is different. So personally, I'm not a nutritionist, so I can't tell, you know, people's specific diet, but I always ask how people are eating, because, you know, some of my patients with MS love beer, love wine. A lot of them love cheeses, you know. I mean, this is mostly everyone that loves these things, but I really, everyone is different. So I encourage everyone to have healthy eating. And if they find that a specific food gave them a lot of difficulty, so like a lot of patients with migraines are very sensitive to cheeses or caffeine or wine or fruits. We have to try to find the pattern, because there's a MS center out in New York. I know they put my patient on a paleo diet and a gluten-free diet, and he lost like 30, 40 pounds in a couple of months and felt amazing. But then every time he would try to eat something, maybe like on a cheat day, he would feel worse. Yes, it's hard to eat clean forever. Like everyone wants, maybe a slice of pizza or something once in a while, but it's really just trying to find the boundaries, trying to stay overall in a healthy state of eating, because you don't want to be drinking every single day or binging on like fast food or eating fried foods. So I encourage everyone to have a healthy eating, because your body, MS, attacks the nervous system, immune system, stuff like that. So we got to try to reduce that inflammation, and that inflammation starts from what we're putting into our bodies.
Right. Isa, I know they were, gut health is huge, a really good probiotic. And I drink chlorophyll in my water for the past 15 years, and it's a digestive enzyme, and it's amazing. And I removed milk out of my diet last year, and unbeknownst to me, I've been a protein shake person my whole life. I've always used whey protein. Well, the knowledge that I gained that whey protein was actually causing a lot of my inflammation, because whey is the junk left over from milk. So I switched to a plant-based protein, a very clean one, and switched to almond milk, removed cheeses. Don't get me wrong, I live in New York. We got the best pizza, and occasionally actually we made homemade pizza last night. But I knew this morning, super clean, ultra, focused on my nutrition today. And I, deal with the little bit of headache and the grogginess and the puffiness because I enjoyed it. But another thing, beer. I removed beer from my diet 10 years ago. I loved a cold beer at the beach. I would always be sick on Mondays with exhaustion and feeling sick. Well, it was the wheat in the beer. So when you Google anti-inflammatory diet, everyone has theirs. mshope.com, Matt Embry, they have amazing, you have Walls, you have all this, but take and build for yourself, because you'll figure it out. Wow, I feel good today. What didn't I have? And then when you cheat, you're going to feel like shit. So it's like you eating, I'm sorry, that's my New York coming out. But your choices, it's like you choose to eat to feel good, or you're not gonna. So I had 2 margaritas the other night, and between the sugar and the alcohol, at 8 p.m. I was passed out, useless. But it was Cinco de Mayo, and listen, I had to celebrate.
A girl's
So
got to live. You've got to have a little bit of what you fancy now and again, surely. I am a big advocate. If you really want something, then you should have it in moderation. My big thing at the moment, I'm on the OMS program, but I've just discovered through you guys, Matt Embry. So I've been looking at MS Hope, and there's this big conversation about you shouldn't have legumes. I love beans and things. I love it. Oh, you shouldn't have gluten. I really like sourdough. What do you do? I'm not eating it to excess. I ate all of these things before I had a condition of MS, and I was perfectly healthy then on my diet. Yes, I've tightened up on the meditation and the exercise and the self-care stuff and the general stuff. But I think if somebody says you must do this, it makes me question, like, who has the right answer on diet?
right.
Really?
Yeah, because everyone is different, and not everyone's diet is going to respond to Terry Wall's diet. Everyone has inflammation to certain things, with or without MS. You have to, what I would say is, try a diet, stick with it for a good 6 to 8 weeks, see how your body responds. If it responds really well, stick with that. If it doesn't, try something different. But just from what I've seen my patients, and not just with MS, but all other inflammatory conditions, RA, Parkinson's, dairy, like doing like dairy-free and gluten-free really works for pretty much everyone. Ketogenic diet, different research for that. I don't want to get into that because I'm not a nutritionist, but what I've seen, what I've had my patients really undergo is like dairy-free and gluten-free diets, and they have significantly helped them reduce body's inflammation, lose weight, and just improve their overall health.
Right. Does anybody else have any kind of question here? Violet, do you want to ask something?
Yeah. Oh. So I have a question. When he was talking about, pushing yourself and everything, how far can you push yourself?
Yeah, so that's a great question. So everybody is so different. What I would say, like, if someone is already in has exercised before, and they're, regularly doing yoga or Pilates, that individual, you can try to push a little bit, more. You want to exercise when your body is in a little bit of fatigue, but you don't want to do it where you could barely, like, if you barely lift your leg, you don't want to be going through those reps. If someone has really never exercised, they just got diagnosed within the past year and they're just starting an exercise program, it's no different. You want to start nice and easy, because whatever you do that first day, first week, your body's going to be really sore, and you have to get used to kind of working out those muscles that you've never done before. It's similar, even for someone does work out and they start doing a different type of muscle group or different type of workout, you're going to get extremely sore. So, in the beginning, start gentle. If you feel pretty good and it doesn't wipe you out the next day and you recover, the rule is if you recover okay the next day, then you can increase your intensity. The next day, if you feel completely, unable to walk or stand or move around, then maybe you have to tone it back a little bit. But everybody's so different. So I would say start off nice and gentle. If you feel well, progress. If you feel like you did a good workout, kind of stay with it for a little bit and then progress yourself gently.
You also have a question to ask?
Yes.
Yes, and
Yes. Oh, sorry. Hi. Thanks
Hello.
for me being able to join this. I got diagnosed last year, May, so it's not the ending of May, so it's almost a year. Everything's kind of new for me, and I was wondering, the symptoms that I have at the moment is a lot of tingling. Well, I'm glad that it's not as much as in the beginning, but is there something that I can do about that, or a certain exercise I should or should not do?
Yeah, where is your tingling exactly? Where do you feel it?
In my hand, and it goes up to my arms and in my legs.
And it's all the right side?
Yes.
Okay. What part of your hand? Is it the whole hand? Is it like the thumb side? Is it the pinky side?
Like the palm of my hand.
Okay. So
Yeah.
if you, we'll try something. If you have your hand kind of like this, and you're going to look straight ahead, and you extend your arm, and then you extend your elbow, or I'm sorry, extend your wrist, and then bring it back. If you do that nice and easy, and then do that about 5 times, does that increase your tingling in the thumb at all, or it doesn't really do anything?
It kind of increases it now.
Okay. So what that's doing is that's kind of that's your median nerve, which is a nerve that comes from the arm. I would try, that's a nerve glide. So what I showed you, looking straight ahead, extending your arm, then extending your wrist, coming back. I would try doing that 10 times throughout the day and see if that reduces your tingling. Are you working on like a mouse or computer at home a lot, or?
Yeah, I do.
Okay, because I don't know if you were here for the beginning of it, but I kind of mentioned like a lot of people have numbness and tingling, but the doctors just kind of blame it on MS, but it could be, more of like an orthopedic thing.
Yeah.
So, you want to make sure like when you're on your computer that your arm is not compressed like this, because you could be getting some peripheral nerve entrapment that's not really related to your MS. Same thing with your leg. What part of your leg do you get the numbness and tingling?
My foot. It starts with my foot and then it goes up to my lower leg.
Okay. So, I mean, that could be more, similar to your arm. It could be some entrapment on your right calf, because those nerves through the calf go to your foot, or it could be from the sciatic nerve. I'm not saying it's not coming from MS, but the fact that you were able to do that thing with your arm and that increase your tingling, Usually, if you can reproduce the pain with or reproduce the symptom, then you can kind of get rid of it with that exercise.
Okay.
So I'm not sure if you aren't seeing have you seen a physical therapist?
I have, and in the beginning because it's not as intense as it was, because she said it could be hyperventilation. So she gave me breathing exercises, and
Does that
that
help it?
yeah, it really did to
Okay,
reduce
good.
the tingling.
What
Yeah.
kind of can you share those breathing exercises? Because maybe that can help some of the others if you feel comfortable.
Yeah, I'm thinking about it right now. So the exercises, she said it's like a hyperventilation. So it could be the MS, yes, but it also could be that I was kind of tensed and that I had a high breathing instead of a stomach breathing. So she made me focus on my breathing pattern to move it from a higher chest breathing to a lower stomach breathing.
Like more diaphragmatic breathing.
Yeah, exactly.
Okay. See, that's great that you're seeing someone, because like I said, a lot of physical therapists, they don't really look at that. They don't look at what are other things that be causing your symptoms. So that's great that you found someone that looked at the whole body as well.
Yeah, she looked at the whole body, and she also gave me exercises to do on the gym ball.
Okay.
And to reduce the stress level, say that the tension or whatever I had for the breathing.
Where is she located, or where are you guys located?
Well, I'm located in the Netherlands.
Oh, wow.
Yeah.
I haven't been there, so.
Yeah. No, I am American, but I live in the Netherlands.
Okay.
Yeah.
Yeah, I mean, I would really, for your arm, I would try those nerve tension glides. Really just be aware of your posture at home, because if you are on the computer a lot, if you're compressing that one side using it on the mouse, you could try some like wrist stretching. So kind of just having, your arm up and giving it a push.
Okay. Yeah, that's what I do a lot.
But if whatever you're doing doesn't help, then like maybe getting like an EMG, a nerve test, to really see where your nerve pain is stemming from. But the fact that we did that exercise and you felt some of the tingling, I would continue doing like 10 of those 3 to 4 times a day, just to help reduce some of that nerve tension. And just be careful of how you're compressing your arm utilizing the mouse at home.
Okay. And are there any exercises that seeing that each MS patient is different, but are there any exercises that like I should not do, or you should, because I was a very fanatic yoga and Pilates person, but now, as Isa said, that my self-esteem went down, so I was really afraid to do certain exercises because I was feeling the tingling coming up during, say, like the down dog or whatever. But are there exercises that I should not absolutely do?
When you were doing the down dog yoga pose, was that the tingling in your leg, or was that what the
No, the tingling in my
arm?
leg, and the tingling and leg and arm.
So that could be because if you're going in like that kind of extension based position, it could be compressing the nerve a little bit. So if you're doing something and it increases the tingling, then I wouldn't go through that, because that means you're probably irritating that nerve a little bit more. You could have had the tingling in the arm because you could have been putting weight through it, also compressing the arm. So if like the downward dog, like the extension kind of bothers it, then maybe try more of a flex position, such as the child's pose, and see if that will reduce it.
Yeah, that would, because whenever I felt the tingling, I went back to the child's pose, and I felt good.
So that, from what you're stating, it seems like a lot of the tingling in your leg is coming from your spine, because if you could put your spine in one position and increase your tingling, and then put it in a different position and reduce it, that wouldn't be like an internal MS thing. You wouldn't be able to do that with just kind of moving your spine in a certain position. Yeah. So I would say, definitely want to continue with yoga, but just do things that are not increasing your symptoms, but rather reducing them.
Okay, great. Thank you.
You're welcome. Good questions.
Thanks.
Angela, you're trying to say something.
Yeah. How do you feel about chiropractic care? Because when I have my atlas and my occiput adjusted every 10 days, when I have like numbness in my arm, I definitely go and I find that I have had injuries, that I've had issues with my in my T-spine, and so I believe in the chiropractic care and acupuncture that I get on a daily, monthly, or every 10-15 days, with opening up my pathways. How do you feel about that? Because as I'm listening to people say about numbness, it comes and goes. To me, it's not always MS, it's
Yeah.
subluxation spine, or like you're saying, a nerve impingement, that so many people, while they're exercising with MS, get so scared of that, and it is like self-imposed limitations to keep going, where if you just push a little bit more, you realize it's not actually the MS, it's something along your spine, right? I mean, how do you feel about those therapies?
Yeah, so I'm very fortunate. So where I work with, I'm a physical therapist. I have an occupational therapist I work alongside with, an acupuncturist. Her name is Amy, and she actually did her thesis and doctorate in MS. So she's very familiar with patients with MS, as well as chiropractors. Everyone that we work with, we all collaborate with each other. There's, unfortunately, there's a lot of poor physical therapists out there that if you're somebody with MS, a lot of my patients that have come to me from other places, their treatment plan was, you're going to do 15 minutes on the bike, you'll do some leg stretches, you'll get a heat pack, and you might do like 1 or 2 exercises where you're kind of on your own. That to me, that is not physical therapy. When I'm patient with them on one throughout, anywhere from 45 minutes to a little over an hour of doing one-on-one specific workouts. The acupuncturist we work with is very specific. The OT and chiropractor we work with is very specific. A lot of chiropractors, most similar to most PTs, most chiropractors, you're going to lay on a table. They're going to kind of do like a 5-minute adjustment on you. You'll get the stim and then you'll go. I think for most individuals, chiropractic is very appropriate, but you have to kind of follow up with doing some strengthening. So if someone adjusts your neck and low back, you always want to do some neck stability and core stability exercises, because what happens is an adjustment is going to feel good, but if you don't kind of strengthen those specific segments, then you're always going to feel like you got to kind of crack your own neck or your own back. Otherwise, it'll feel really stiff. So I definitely believe in the chiropractic. It just has to be done by the appropriate person. And I believe it has to be accompanied with certain workouts to maintain that spinal stability. Same with the acupuncture. I definitely think it can help, because I know our Acu Amy, she uses a lot of points on the scalp, like for the central nervous system. And, doing all that stuff together can help.
Yeah, 'cause when I had the optic neuritis and lost the sight on my left eye, unable to drive, the acupuncturist, I did 15 days of sodium medrol at the hospital, which you did 3. I had 15 days. I looked like Veruca from Willy Wonka, and everything that, with my Coca-Cola glasses, it lasted 5 months. And after 3 months, I was ready to put a bullet in my head with 2 small kids at home. I had an acupuncturist come to my house, and there were points that she put on my legs, that put on my chest, on my brain, that my healing, I felt, came with that, and like the essential oils that she used on me, and the chiropractic care where they came to my house because I was unable to get to them. And I felt like that was actually more healing than the drugs that were pumped into me. So, but that's my approach with it for the past 16 years. I'm more like holistic, but
Yeah, the acupuncturist, she can do some things. Like a lot of my patients come in with bladder, difficulty with their bladder, vision symptoms. So some of that stuff I can't help at all. I know there's maybe some physical therapists that could do like pelvic floor stuff. That's something that I can't do, but I know an acupuncturist can assist with that. Sleeping is very important, because if someone is not sleeping correctly, and that's going to give anyone fatigue, but especially with the MS society, MS community. So they can work a lot on reducing stress and anxiety levels. Exercise will do that. you know, I can talk to my individuals about staying positive, but, you know, the acupuncturist can work on those points as well. So it's not really just kind of having muscular pains, but the and doing like more of like a full body approach with certain internal issues that I as a physical therapist can't really address.
Right. We have other people like Aman, Roya, Hassan, Huwei, Saras. We cannot see your video, but if you have any question, you can please go ahead and ask.
And then I also have a question as well. So, you know, when certain people were asking questions, I kind of took like a screenshot of it. So I don't know if you guys are okay if if I send it to the MS awareness and they can kind of post, or you don't want to kind of be like a screenshot picture.
Are you gonna do a countdown like 3, 2, 1, smile?
Well, I took a lot of, I took like when you were asking a question, I took like a little photo. So, you know, maybe if you guys add me, I could send you the photo and then you can tell me like, yeah, post this or not, because this is the first time I'm doing this kind of Zoom meeting with you guys. So I kind of want to, you know, I know there's millions of people out there with MS. I think it'd be great to kind of encourage others to join.
This is phenomenal. This is absolutely amazing. It's the first time in 8 years that I've been on with somebody that, with my fellow MSers and with a professional. Like, it's really cool that you're doing this. So you have my permission to post whatever the hell you want.
Yeah.
Cool. Well, I will send them to the administrator, and then you can, she can make a post and ask you guys. Because, but feel free for anyone. Like I made an Instagram neuro page, so it's on Instagram as neurodoc_NJSW, and you guys can always feel free to send messages. I have inquiries, and what I try to do is like make like a little video that can be specific to your specific needs. Because when I make general videos, it's usually just what I'm doing with my patients in the clinic, but not everyone can relate to those specific patients.
So I'm gonna make the video for this and share, and then you can tag all of them. You guys add doctor, and I think you know, later on if you have any questions, you can directly ask him too. He's quite helpful. He has been helpful to me.
Right, hang on.
Yes, Sally.
Uh,
Sorry, your voice is breaking a lot, Sally. I think there's some.
question.
Sally, there's some connectivity issue. We're not able to hear you.
Oh, sorry. Hang on. See my. Oh.
Can you try?
Can you see my rabbit?
No, we cannot see anything.
I lost you.
Yeah, now it's fine.
All right.
Can I say something?
Yes.
I agree with is it Isa or Isa?
It's Isa. It's Isa. It's like Lisa, but without the L.
Okay. So what Isa said, I must agree that, because this is a whole new journey for me, and I didn't even know what to expect. I'm only now starting to accept the fact that I have MS, taking medications. While before that, I never used to take any medications, not even for my headache. And I was really on a more natural and holistic path, I would say, and getting the diagnosis of MS just made my world upside down. But I think this is pretty cool. We don't even live in the same country, on the same continent, some of us.
I live in England.
Yeah, well, I'm in the Netherlands. So yeah, but no, really, Dr. Zola, I think it's also very cool that you have made time for this, and that everyone has time for this and sharing the thoughts. And for me, everything's new. And I heard some people say 16 years, 8 years, and I'm like, wow, okay, how am I gonna go through life like this? But this does give me strength, and I don't know you guys, but really you're in my prayers and in my hearts already, because this is so awesome. Just sharing, sharing the thoughts and ideas with each other. You never know what can help and how someone else can help it and how it can help another person. So thank you.
Where, do-
Oh,
oh,
I
where
think
do you live in Holland?
I live in Rotterdam.
Oh, I
I
used to travel a lot.
Yeah.
Sorry.
So yeah, no, but I thought that it's not really a question, more something to add. I think this is a really cool
Mm.
thing
Oh,
that we can do and that we have the technology
yes, and
that this is.
actually, so this is our second live session that we are doing here. First one was an interaction between all the MS warriors. This is the first
Mhm.
time we're having any doctor on the show, and he's helping us answering our questions. We're
Okay, cool.
having such sessions
sorry.
more often, and Dr. Zolo has also, recommended that we should.
Hello, can I talk?
Yes, of course. Is this Roya?
Yes, it's Roya. Hi, hello everyone.
Hello.
Cause I live in Sudan, so the internet connection is so bad, so that's why I just used the speaker. So for me, in our country, in the region, MS is really really rare disease. They don't know about it, even the doctors. And most of the people here are like having 2 3 years for just diagnosing, and there is a problem with the physical therapist also. They don't know acknowledge what MS is.
Oh,
There is also like yeah, there is a lot of problems, but thank you for the information that you like all share, and I'm trying to learn so that I can talk to my friends with MS, because the depression is really high. They just like think it's the end of the life, because here the life is really really hard, mobility and everything. So thank you for the hope, thank you for your information, thank you doctor. Like I really really had to know a lot of things when you ask and when you answer. But so my question is, my walking is like, it's 8%, 80%. It's improving, but it's really slow. So what is the exercise for my for improve walking? And I have bladder issue also, if small tips. And thank you.
So with the walking, I mean, we have to figure out where is your weakness stemming from, because your walking might be limited from the glute, it might be limited from the hip flexor, it might be limited from the hamstring, the quad, or the ankle. So really, we have to try to address where is it.
It's like the end of my back, my core,
Your
my
core.
my core, the end, my back. It hurts. So I think my legs also, my thighs are really weak, and my knees
Yeah, so
really
that's
heavy when I'm walking, when I'm moving. Yeah.
right. So that, it's really like to try to work on full body. If you're feeling those areas pretty much all over, trying to
Yeah.
start off nice and gentle. I mean, bridging if I would have to give like maybe 3 exercises that everyone can do that can work on full body, bridging is really good, because that's when you lay on your back with your knees bent and your hips come up, because that's going to work on your glutes as well as your hips out to the side. The
Okay.
second exercise, encourage everyone just really practicing your hands together and just sitting and standing up and coming down. That's going to work a lot on your thighs. And the third
hang
one,
on.
really like a good set of exercises standing and just trying to go up on your toes. Some marching in place. You guys see kicking out to the side or going straight back. I don't know if you guys can see or not. I should have like a videographer next time, but here
Marching.
we go. Kicking out to the side, kicking straight back, marching up, going up on the toes, you know, so, but I would really say, like, you know, doing some bridging, standing up from a chair, and doing some heel raises, toe raises is really going to be pretty helpful. But really trying to make sure that you're doing it throughout like a daily activity, making sure your diet is good, because if your legs feel heavy and then everything could just be inflamed, that's, if I hope that helps.
Okay. Any other question?
And then, you know, I can talk with the administrator, but I can do this maybe, you know, if you guys want to meet back up, maybe the next 3, we can set up the same day and time, the next 3 Saturdays, because where I am, all travel is, you know, usually I'm very tied up on the weekends with work. But the next 3 Saturdays, I am available to do this as well. And we can kind of make it a weekly thing. And I'll make an exercise when I get to work on Monday. I'll make a video of exercises post acute exacerbation. If you guys have any other questions or exercise videos that you would like, just send them to either myself or the administrator, and we can kind of, you know, come up with things week by week.
Last questions left for the doctor.
Yes.
Yes.
Yes, I've got. First of all, I want to thank Multiple Sclerosis Awareness and the doctor for this truly incredible session. It's really very helpful and very informative, and I hope that we can do it more often in the future. So I know that this has been talked about before, but I've been having a lot of what I feel is numbness in my left cheek, which is usually accompanied by numbness in my left arm and sometimes also in my left leg. And this has never happened to me before. It's only during this lockdown. So I'm really not sure what's going on, because it's not like it's persistent. It comes and it goes and it comes back after maybe a few days. And so is there like, what's going on? I'm not sure.
Are you sitting a lot more because of the lockdown? Like, are you know, are you normally working and now you're home working, or what's, you know, if you could give a little bit of a situation, what's been going on since the lockdown for you specifically?
Yeah, I mean, I've been working a lot at home, sitting down, working on my computer. That's what's going on. Yeah.
Yeah, I mean, so I'm not sure if you were here from the beginning, but a lot of that numbness could be like more from peripheral nerve. So if you feel it in the cheek, it could be more like in the piriformis muscle. Some exercises that I would distribute to my patients that feel that is really just laying down on your back, having a leg come here and across your body. So you should feel that stretch right in the hip. If you start doing that and you start feeling that numbness in the glute, that means that is where the numbness is stemming from. When you're doing stretches, you want to try to hold it for about 30 seconds. But it's really, it's tough to, you know, just general kind of advice is that with the lockdown, everyone is kind of sitting home more, doing less. Things are tightening up. So if people are working from home, try to keep yourself moving. If you're normally at work and you're sitting for 6 to 8 hours a day, try to get up every at least 45 minutes to 1 hour and just do like 5 to 10 minutes of stretching, because the more that you're sitting, everything's compressed. If you feel some of it in the arm, one of the young ladies asked, you know, I asked her if she uses her mouse a lot with her right hand, because that's where she was getting the numbness. You want to make sure you're not like compressed this way when you're utilizing the mouse. You want to try to, you know, keep everything in a nice neutral alignment. But just try to do some of the stretches and really figure out what is causing that compression, because it can be from, you know, the hip that's making it go down to your glutes. It could be from the upper trap muscles that's making it go to your hand.
Thank you, doctor. I'd just like to add that most of the times the numbness where I feel it the most is my cheek, and also sometimes I feel some fear in my ear. That's where the most of the numbness is from.
Yeah, so that could definitely be your piriformis muscle. So just try, you know, you could even like try that stretch that I showed you, or even try to use like a golf ball and put it right where that cheek is and just kind of roll back and forth on it, because you could have a trigger point that's adhesing to that nerve, and see if that helps release it.
Got it. Thank you, doctor. Thank you so much.
You got it.
During this lockdown, I'm seeing that lots of patients are messaging and they're saying that they have problems of back pain, they have problems of heaviness in their legs mostly, and probably some of them are also getting anxiety attack. That's what
Right.
getting that people are getting all these problems. What do you think? So, for example, it's lockdown time. People cannot move out of their houses, do a lot of exercises. Even they're at home, they should move around a little. How many steps in a day? Nowadays, we talk about number of steps people do takes. How many
Yeah.
steps ideally a person should take in a day?
There, that is very hard. I would just really just try to keep everyone. Well, if someone is not like, if someone has been really home and they're normally not very active, start small, shoot for 100 the first week, 500, increase it to 1,000. Set goals, and week by week, like maybe one week you're gonna shoot for 500 steps a week, and then the second week you're gonna shoot for increase it by 10%. So you'll do 550. The week after that, an additional 10%, so 610. And really just try to get to set goals for yourself, but it's really just trying to keep yourself as mobile as possible.
Okay, I set goals for myself when I was diagnosed with MS last March. Okay, Dr. Zolo. And I started off doing steps of 10,000 a day, but it was quite tricky because I was working in the city in London. Um, from since then, I've kind of worked freelance and had more time on my hands, and certainly during lockdown, I have been more active, going out for walks in the morning and trying to avoid people, and then doing gardening, and then trying to do steps around the house. So I think I might have to scale it back. I think my steps yesterday was something like 26,000. So I'm doing a lot more steps because I don't like to sit these days. I like to be more active.
Yeah, but
When I
I
push
mean,
myself, I'm not tired. I don't feel fatigued.
yeah,
So,
if you're feeling good with it, I
I
would
feel
keep. I
great.
wouldn't. I wouldn't push it back. I would keep going.
Perfect, thank you. I just needed some reassurance because I'm just thinking, I don't know if I'm doing more harm than good, but I feel fantastic. I feel fitter now than I did pre-diagnosis, I have to say, for me personally.
Yeah, I would definitely. What I would do. What I would say is just keep up with it,
Okay.
because if you're feeling good doing 26,000 steps, I
Mhm.
wouldn't scale it back. I wouldn't think that you're doing too much. If you have a workout, if you do this one day and then the
It's through
next
the
day you
whole
feel
day. It's
wiped
not in
out,
one go. It's not like
right?
one stretch, otherwise I'd be on the floor. It's throughout the whole day. So if I go for a walk, it's 45 minutes. And then I get the rest of the steps just through my normal activities of going around the
Yeah,
house, walking,
I would.
gardening.
I would definitely keep it going. I wouldn't reduce your activity. I would continue doing what you're doing and really encourage others to follow in your footsteps. Maybe like start like a little virtual walking group we can do. But that's a good idea, right? So you
Yeah, it's a
definitely,
great idea.
I wouldn't reduce your activity. I would stay active, especially that you're feeling so good with
Yeah.
everything that you're doing.
And I do yoga as well, as I explained just before I jumped on the call. So
Right. So I would keep
I
up
do
with
that
all
quite
of
a
it.
lot. I do that pretty much every day. Not I probably do it 6 days a week for around an hour. So I am more active since diagnosis. I think just because my own self care, I guess.
Yeah,
But
I
not
mean, honestly,
everyone.
a lot of people have been more active. I know normally, like myself, I have been, because normally I work like a 13-hour day at work, and because it's been a little bit slower, we haven't been um, working as much because our patient hours are limited. So it's allowed me to kind of work out more than usual. So it's, everyone is different. You just try to find something that you feel comfortable doing and kind of stay with it.
Thank you. I just wanted some reassurance. Thank you so much.
okay,
You
so
got it.
Michael, Hawaii, and Saris has been with us all this while but have not asked anything. Any questions you have for the doctor today? Or we can have the last question if anybody has, and then we can end.
I don't have any questions. I've been sitting here making notes and absorbing everything. Uh, Before the lockdown, I worked out 3 days a week. because we have mandatory workouts at in my workplace. Um, with that being with that being stopped, I have seen where I was healthy before with the MS, and I was able to do a lot of stuff because of the workout. I can see now where without that workout, um, I can see where some issues have popped up, and hopefully that will get back to normal sometime around the end of May, beginning of June. So I just do light things around my work area, um, and but yeah, I've that's the only thing that I've noticed is my right leg issues, um, and some more fatigue where that had stopped before. So basically, I guess when the workout starts back up for us, um, I'll have to start all over. So
Right.
Yeah, so I would just, like, especially with the legs, because, it's hard to work out if you're used to a gym setting, but with the legs specifically, there's so many different things that you can do. Just what we mentioned for, like, sitting and standing from a chair, going up on your toes, even like holding on to a wall, or like something like here where you can hold on and do some squatting. Um, a good one that we haven't really brushed up on is for balance and for ankles is really trying to hold on and maybe do like a couple steps when you're heel walking or walking in your toes. That way you could work the balance as well as work the ankles. But really just try, because nobody knows when this lockdown is going to be over. I'm not, I don't think it's going to happen anytime soon. So you don't want to really go a couple of months without doing as much activity. I would try to do as much at home as possible, maybe order some bands at home, because you can do a whole workout at home without any equipment. I have about 7 videos that I have posted on my Facebook. It's not for MS, it's for hemophilia group, where I'm kind of showing, like, one of them is a leg workout, one of them is an arm workout, one of them is a core workout, one of them is just stretches. So there's a lot of videos that I have on my Facebook just for my job and that I've made for other organizations that you can look up, and just they're like 6 or 7 minute videos that you can do without any equipment at all.
All right. You share that. Doctor, I have always noticed that, if I'm doing exercises, it's fine. But if I stop doing exercises for like 15 days, I start having cramps. And the cramps are like really, really bad. I get up at night with painful cramps at the back, on my calf. So that's what I get. And the only thing which really helps me is squats. I don't know why, but squats really help me. And I
Yeah.
squats 25 times, 50 times a day. And when I'm perfectly fine, I even go up to 100. So squats is something which has helped me personally.
Yeah, well, anytime you're getting blood flow through the legs, so squats are great. Going up on your toes is good because that's working the circulatory system in the calves. You have pumps in the calves that are helping with circulation, as well as just laying on your back and doing leg raises, because anytime your leg goes over your head, get some blood flow going. So I would definitely keep up with those 3 exercises, because cramps can happen from muscle inactivity. They can happen from water deficiency, vitamin deficiency, but the more that you're moving your body, the more that you're getting blood flow going, the less chance of cramps occurring.
Also, there's one more thing which I had mentioned last time to everybody, that last time when I had MS attack, I was barely able to take a few steps. The only thing which really helped me recover quickly was hydro exercises. I used to get into the swimming pool and just walk in the swimming pool itself, which really helped me to come to recover fast. So what do you say about hydro exercises, and does it help everybody, or is it from case to case basis?
So I do aquatic physical therapy is something that I teach kind of like on the side too. So it definitely can help. You don't have to know how to swim, but some things that I recommend in the water is walking backwards, because that's an exercise that I give a lot on land, because that helps with the glutes and the balance. Walking sideways in the water too. because walking backwards and walking sideways are two great workouts to target the glute medius on the outside and your hip extensor, which is on the back, as well as strengthening the body. Other things you can work on in the water for core, you can have your hands kind of clasped together and do some twists to one way, twists another way to kind of help work on the obliques, as well as going walking on your toes and your heels. The reason why the aquatics is great is because if you lose your balance and fall, you're not going to get hurt. Everything you could do on land, like those leg kicks, you can do squats in the water. You could try to do like gentle jumping jacks, but really the main things that I would focus on in the water is walking backwards and walking sideways directions. Right. So I highly encourage aquatic exercise because it's a safe way to build strength, build balance, and really work on endurance.
Right.
This is just a request. I don't even know if you would have time to do with this because you clearly work a lot, and we've talked about so much, and I'm just like, I wasn't like Michael. He's not on here anymore, but taking notes. My brain just doesn't work well when it's fatigued, and I forget everything. I don't know if you would or would like to or consider putting together,
a live workout.
Well, that would be great, but also like maybe just even like like what you described for me, like post relapse, this is what you should do, 1 round, or aquatics 1 round and do this, and then kind of like list it, and then maybe like new diagnosis, this is maybe how you should start incorporating exercise into your life. I'm just saying generally, not just for me, but like my family of MSers, that we're all so different. As you very well know, every MS patient's different, and all our diseases are different, even though we understand we're all the same. It's weird. So I don't know, it's just a request. I understand if you say no because you have a job and you have patients and you have to do your own thing, but I just don't see it on the internet. I put it out there on my own page, and that's why I created my Instagram. But
which one is that? I'm not sure if I follow that one.
I just followed you this morning. It's isa.msathlete.
So yeah, so what I'll do is, maybe on Mondays we could call like MS Mondays, and I'll make a couple of videos. Cool. So the first one was exacerbation of symptoms, stage 1 exercises. Then you said something about the water. And then what was the third?
Just like newly diagnosed or really kind of clueless kind of patients that are just scared. There's so many people out there that are within their first 4 years or first year, like Zenaida. She was afraid, and we don't know. I was like that when I was newly diagnosed. They didn't even know what I had, and I didn't know what to do, and I was afraid of everything. And we get a direction from somebody that like legit cares, that goes out of their way. Like, we will listen to that, because I don't listen to my neurologist all the time, because sometimes it's just like I'm just not there. I don't trust as much, and it's a little different coming from you. I don't know why. I'm more apt to listen and take a look, and for somebody to go out of their way, for people like us, we're more apt to believe you, listen to you, and follow your direction. I know I am, and I bet you a lot of us on here would also. And I know you would find a community like us, which is so, such a variety, is that, the host will tell you, we're such a variety of a group that I think everybody would benefit from something like that. If you even had a like inkling of a moment that you could put something like that together, it would be amazing. It really
so if you can message me, so I'll definitely put together the relapse video, because I've never thought about doing that. It's a good idea. As well as, the water one will be a little bit more challenging, because I don't have a pool, unless I have a little lake in my backyard, but I don't know if it's safe to go. I don't know if there's alligators in there, but and then I could definitely
have
do like
one.
I
have one, and I could videotape it, and you could post it.
Yeah.
You could use me as a whatever, but you would have to tell me what to do.
Right.
So I'm just saying, I just don't know if the rest of the crew here would benefit from that,
I definitely think, you know, anyone would. And then if you guys can like repost it and, you know, let them know that I can post content for them. And then someone just asked me if I have a YouTube channel. So I do have a YouTube channel. So, you know, what kind of got me to work a little bit with the MS community, I have a chronic condition myself. It's a bleeding disorder. And I've been doing presentations for the bleeding disorder community for the last 5 years now. And then I thought one day, you know, maybe I can do this because I started treating patients with MS in my office. I'm like, all right, I'll reach out to the MS Society in New Jersey. And I kind of partnered up with them. So that's why I have like a special interest in, you know, treating neurological conditions. So I do a lot of presentations. And what I did is I started a YouTube channel where it actually has me doing like a 30-minute workout. It has me showing some kinesiology taping techniques. It has me showing some workouts, but it's not really saying anything about MS, but it's applicable to everyone. It's called HemoDoc for hemophilia. It's HEMODOC. But I'm not really, because of all this lockdown stuff, I haven't done any presentations the past couple of months, so I haven't really posted much. But I could type that in the chat. So yeah, that one I use more for the bleeding disorder stuff. But I'll definitely start it up this week. I'll post a video on Monday, and we can kind of have like a MS Monday, MS Monday series. I will send you some aquatic workouts, what to do. Maybe I could take a video of myself doing them on land, and then you can kind of replicate them in the water, make a video. I can post that. I'll do the MS flare-up video, and then maybe another one I can do is talking about individuals newly diagnosed with MS.
Take week by week every topic and go ahead.
Yeah, I could send them to you. You look like you are good at editing. I don't know how to edit the videos to make them, so I'll send you my video. You can assist in the editing portion with like your logo on it, and then
I'm a photographer by trade, so that's why.
Yeah.
A bit of delegation there.
I just know how to make content, but I don't know how to make it look nice. So, yeah, definitely. And like I said, I'd like to do this the next 3 Saturdays as well, and see if anyone has new questions, or based on what we talked about today, you guys can try it out for the next 7 days and come back with questions, because everyone is so different. It's hard to address questions when I'm not seeing you guys face to face. But I hope whatever we went over today helped a little bit. It seemed like it went well, so I'm happy I was able to get on this call.
Okay, so I think everybody's done their questions, and thank you so much, Dr. Zolo. It's always a pleasure to be with you. Last time we had a live session on Instagram, 500 people saw us that time. And
oh, wow.
This is a small group who are very connected to each other and know each other quite well now. So we are like a family, and we will have more questions coming up later on. And yeah, your idea of doing weekly kind of thing is, of course, we should go ahead with. Okay, moving ahead with, thank you, Isa. Okay. So there's one more thing I would like to talk to you about. So on our page, we keep doing a number of challenges. And now 30th of May is a World MS Day, and I thought, doing something little exciting. Last time we did something about workout with MS and the other challenges. This time I want to come up with a challenge which says beat MS with. Hashtag beat MS with, and whatever you like, whether it's yoga or it's your cooking or walking or anything. So I've made a short video. I think I'll show you on my iPad because net connection is not very good here. You just have a glimpse of it, and I'll be posting this on the IGTV also, and everybody can make a video like this and give it to me. So I'm not sure if you know about Don't Rush Challenge. Have you seen that? Okay, so this is a copy of Don't Rush Challenge. I'll show you the video. Go touch, Brian on white. I got go country. Go bust. I got lose trust. So this is what we are thinking of, making a Don't Rush challenge, beat MS with video. So whatever you beat MS with, it's yoga or exercises or walking or cooking, whatever, you think helps you. So this is, taking your mind out of the lockdown mode, the depression you have. It's just an exciting thing to work on. Just 2 3 things. You have to hold the mobile coming on from your left, show it to the screen, and then right, no, and then take it back, and then you under transformation, and then throw it back again, and the cycle continues. So the details I'll be posting on IGTV, and I hope everybody sends their videos. And on 30th, I can compile all the videos of everyone together and post it. And Dr. Zolo, I will be very grateful if you also participate in the same. You can say,
Okay.
beat MS with.
Awesome. I definitely will do that for you guys, and I'll send it over. So
Sure.
thank you for having me, and hopefully maybe you can message me, and if you want to do next couple Saturdays, I'm definitely available. So
absolutely, sure.
Alrighty. And if anyone has any questions on the side, just send me a message if you care. I don't know if you want to save this, because I know you can save the Zoom meeting and post it, but I'll make those videos and I can send them over, and you can help me out with them, okay?
Of course, we'll repost it. Okay, thank you, doctor. Thank you so much. Thank you, everybody, for being here.
You got it. Have a great day, everyone.
Have a
Bye,
great
guys. See you
Bye.
later.